COVID Response Commander, to provide the people of Victoria with an update on the current COVID cluster and outbreak. I'll make some introductory comments and then I'll get the Chief Health Officer to make some further updates, and then Jerome, and then we're happy to take questions. So there are 4 new locally acquired coronavirus cases today, bringing the total number of people linked to this outbreak to 64. These 4 cases are made up of, firstly, 3 members of a family linked to the West Melbourne outbreak, 2 parents and a child. We have an indeterminate result on another child, and we are currently investigating the nature of that case today. The 4th, the remaining case for today, is a primary close contact of an existing case, and they were in quarantine during their infectious period. Brett will speak shortly to some of the findings of the genomic sequencing associated with the West Melbourne group. Briefly before I hand over, these new cases highlight the efforts that Victorians have put in to keep ahead of this chain of transmission is not over. We are working day in and day out as a community to make sure that we overcome this virus. The pandemic has shown us time and time again that it's so important that Victorians step up and play their part in making sure that we run this virus down. We're seeing this in so many ways. We continue to see it in record testing numbers. Yesterday, in regards to COVID-19 testing, we saw another 49,439 tests, continuing the really strong run that we've seen over the course of the past 2 weeks. We're also seeing this in record vaccination numbers. Yesterday, through our state-run clinics, was another record testing day of 24,169 vaccinations through those clinics. And most importantly, we're seeing it in the everyday efforts of Victorians in our community as they go about doing the right thing, wearing masks where they should, abiding by the current circuit breaker lockdown rules where they have to. It's hard work. Everybody knows it's hard work, but it's important work if we're to get on top of this virus. As of 11:59 p.m. last night, Victoria moved to restrictions that we had announced, regional Victoria rather, moved to the restrictions on a lesser basis, and Metropolitan Melbourne also tweaked some of its arrangements. For Melbourne, that means there are still the 5 reasons to leave home: shopping for food and supplies, authorised work and study, care and caregiving, exercise and getting vaccinated. People can travel further for exercise and shopping with an expanded 10-kilometre radius. Students in Year 11 and Year 12 return to face-to-face learning. And a number of outdoor jobs have been added to the authorised list, things like landscaping, painting, installing solar panels, letterboxing. For regional Victoria, the changes have meant lifting the travel restrictions and the 5 reasons to leave home. All year levels and all students in regional Victoria have returned to face-to-face schooling. Public gatherings, catching up at park or in places, has increased to 10 people. Restaurants and cafes can open to a maximum of 50. Finally, before I hand over to the Chief Health Officer, I wanted to thank the thousands of our fellow Victorians who are currently going through the 14-day quarantine period as immediate contacts, personal close contacts of known cases. It's the most challenging thing you can do, but it's so important. And on behalf of all Victorians, we thank you for doing your part in keeping the rest of us safe and making sure that we can get ahead of this effort. Your individual efforts are keeping our community fighting this virus and keeping the most vulnerable members of our community safe. I might ask Brett to say a few words, followed by Jerome.
Thank you, Minister, and good morning. So sequencing has come through on 2 of our original West Melbourne cases overnight, and that sequencing has identified a new variant that is unrelated to all of the other cases in our cluster thus far in Melbourne. That variant is the Delta variant, so it's the B1617.2 variant that is now infamous in India and increasingly in the United Kingdom. It is a variant of significant concern. The fact that it's a variant that is different to all of our other cases means that it is not related in terms of transmission with these cases. It has not been linked to any sequence cases across Australia from hotel quarantine or anywhere else. So it has not been linked in Victoria or any other jurisdictions. Now, we know this family travelled to Jervis Bay, and we are examining who is the likely index case in this family, and therefore trying to trace back where this variant has been picked up. We're working with our New South Wales, ACT and Commonwealth counterparts in that regard, given that Jervis Bay Territory has a combination of responsibilities across those jurisdictions. In terms of the ongoing sequencing, we will try to look at all other sequences, resequence to the fullest extent possible across Australia to see if there are any potential linkages to known cases. That includes those who've come through formal quarantine, but also anyone else, maritime, airline, diplomatic and otherwise. It's obviously a concern that it's not linked to other cases, but we are absolutely, as we've done for the Melbourne cluster, chasing down all of those primary close contacts for this family and looking into where it might have been acquired. But I'll hand back to the Minister or Jerome. I'll come back to questions in a moment.
Thanks, Brett, and good morning, everybody. Just on the remaining active cases we have in Victoria, and then I'm sure we'll return to the West Melbourne cluster. We currently have 64 active cases now that we are looking at in this wider cluster. 3 of those cases are currently in hospital, 2 for precautionary reasons. They are otherwise well. 1 other person is still recovering, and of course we send our best wishes to them in their ongoing recovery, as we do, of course, all of our positive cases. We have now over 6,000 primary close contacts across the outbreaks. We have 90% of those primary close contacts have now returned negative test results. So again, we're seeing that proportion increase. We're very pleased at the response, and can I just say a huge thanks to the 477,000 Victorians who've got tested since Monday of last week. It's been an absolutely huge effort to get so many people to get tested. It's so important in building up this intelligence around the picture of these outbreaks and where these potential change of transmissions may still be. Test results, again, 49,000 test results yesterday, 87.7% of those being returned within 24 hours, and a huge thanks to the people doing the very long hours, the people working at the testing centres, many of them working more than 12 hours, the pathology labs working around the clock. My thanks to every single one of those for making this possible, and of course for all the Victorians who are doing that testing work with us. Since Monday of last week, we've also now seen 340,000 vaccinations across Victoria, across the GP network and the state clinics. 171,000 of those, half of those done by the state clinics, the other half by the GPs. And again, my thanks to the GPs. I know they're massively overwhelmed with demand for vaccinations, and all the people working at our 40-odd state clinics and vaccinations, and the people who are doing the hard work, making appointments, standing in line to get their vaccinations done. It really makes a massive difference, and we can start to see that vaccination curve lift. It's a very important thing for us all to do and to sustain over the days, weeks and months ahead until we have the Victorian population vaccinated. 838 home visits yesterday to primary close contacts who were and cases who were isolating, and again my thanks to all those people who are isolating. We are now getting to the point where we're getting to day 13 testing, and we will get to the point over the coming days as we start to close down some of those PCCs out of their period and releasing them. So that will be, I'm sure, a date that many of them will look forward to. In terms of the 3 different parts of the outbreak, the City of Whittlesea outbreak has no further cases at this point in time. The Port Melbourne cluster, again, related genomically to the City of Whittlesea, and we know the index link. Again, no change there, no more new cases. The two cases that we removed from the board, the two cases that turned negative that we updated on last night, were both associated with the Port Melbourne outbreak, and they've now been removed and released. The aged care cluster of 5 people, again, no change in that cluster. We have continued to do a 48-hour testing cycle at the two aged care facilities in Maidstone and Sunshine, as we continue to make sure that we've got every possible information about any other transmission at those venues. We've seen no other changes to date, but we will continue that 48-hour cycle as we go forward over the days ahead. We have 2 further cases. As an individual with South Bank, his partner has turned positive, so that's one of our 4 cases today, is a primary close contact who was already isolating. Their remaining PCCs are currently still negative.
Which cluster was he related to?
She's related to, indirectly to Port Melbourne, so genomically linked to Port Melbourne, indirectly related. We're still trying to track down the exact link. And then, of course, as the Minister has said, the West Melbourne cluster, now 7 people. My particular thanks to North Melbourne Primary School, and we have over 300 primary close contacts at North Melbourne Primary School. 70% of those, 70, have now come forward and returned a negative test result. So that's a good start. Obviously, we have a lot of work to do around this cluster, not only upstream, as Brett has indicated, but also downstream on any other further PCCs. Finally, let me just add my thanks to, as we go into another really important weekend, really important few days, there will be a lot of testing activity, a lot of vaccination activity. All of our centres will remain open over the weekend, all of them operating extended hours. My thanks to the thousands of staff who I know have had a very hard 10 or 11 days so far, and we will have another very busy few days ahead of us. And my thanks to all Victorians for working with us to run this outbreak to ground. With that, the Minister, Chief Health Officer and I will take any questions.
I think it's just important that the Chief Health Officer explains that new variant and explains why we should be worried about it and what it means.
So the new variant, the Delta variant, is the one that's become the predominant variant in India. It's obviously had very high transmission potential because it spread extremely rapidly across India to become the predominant variant, indeed almost the exclusive variant there, and in surrounding countries, Nepal, Bangladesh, Sri Lanka, all also affected by a significant uptick in cases related to that variant. It does appear to be the most significant in terms of transmissibility. There isn't much information about severity of illness with this variant, although there are some anecdotal reports of greater severity of illness in children, as well as potential increased transmissibility in children. So we've got concerns for that reason. Rich?
Sorry, Brett. Is the working theory that this spread to this other family has gone between 2 grade 5 students? Is that what the working theory of how it's spread?
We suspect so, but we need to look further, but that's the likely transmission at the moment.
And do you have a working theory on where the index case of this may be? Could it be in New South Wales, regional Victoria, or is it most likely to have happened here in Melbourne?
No, we really have to explore all avenues. We have to be clear who the likely first case in this cluster is, and then to go through a really forensic process of understanding everywhere that they've been, and obviously all of the testing of those people that they might have been in contact with, including blood tests if people have recovered from illness.
So is the theory that the family got it through a grade 5 student, or that they've given it to a grade 5 student?
Likely that it's been transmitted to a grade 5 student. So the likely primary case is in those first notified cases in West Melbourne.
And how many people do we have linked to that cluster altogether now?
So there are 7 individuals.
Have there been any cases of this variant in hotel quarantine at all, or is this the first in Australia?
So this variant has been known in hotel quarantine. Obviously, it's becoming a common variant, including in Europe. So we're seeing it in international travellers. But in terms of closely genetically sequenced related cases, we don't have anything across Australia that matches. There are some sequences that cannot be fully sequenced, and therefore they're not available for matching, but that's part of the process that the laboratory will go through in terms of trying to work out if there's a match.
The initial West Melbourne case returned to Melbourne on May 25, had symptoms the following day and was tested here on May 31. The only exposure sites listed are some BP sites on the Hume Freeway. Are you guys still comfortable in that knowledge that the only exposure sites while this person was infectious, were those BP sites? Or now that we know that there are more cases, are there more exposure sites?
Not that we've identified. We're aware of other private exposure sites that are fully followed up, but in terms of public exposure sites, no, nothing else.
So how many primary close contacts are there of people who have the Delta variant?
I'm not sure the number. It'll evolve over time. There's obviously new cases today.
For clarity, can you...
When did you become aware of the Delta case?
Overnight was the sequencing, yeah.
Can you, for clarity, explain who the 7 individuals are? Obviously, 4 are in the family. Who are the other 3?
So those announced today, 2 adults and 2 adults and a child. There's another indeterminate case in another child that's likely to turn positive but is not in today's numbers.
The positive case that you mentioned, is that a grade 5 child?
That I mentioned?
Yeah, so the 2 adults and 1 child. Is that child a grade 5 student?
Yeah.
Is
They are.
And
that
is it the
particularly
parents?
Can we just get a breakdown of all of those cases, if that's possible?
We'll provide that.
Do we have that information now?
Well, I've just told you there are 2 adults and 2 children in a family of 4. There are 3 additional cases today that have been explained.
Is it a particular concern that this spread appears to have occurred between 2 children rather than adults, or is that consistent?
Transmission between children's always been known. There's been some dispute about how commonly it occurs and how likely it is in particular settings and with particular variants. This variant has some anecdotal reports of greater transmissibility between children, but it's not a new event. It has been, however, more reassuring that we tend to see less transmission within school settings and between children, but we have to be alive to, new evidence and obviously what's occurred here.
And does this Delta variant set us back in terms of the Thursday timeline?
Oh no, I think we review as we always have, based on what else emerges. We will shut down the downstream transmission, as Jerome referenced, so all of those people who've been exposed from this family. But we do need to understand where it's come from, and that means that there are unidentified upstream cases. Whether they are in Victoria or elsewhere is to be determined.
Given the timing of this family's trip to New South Wales, how likely is it that they picked this up in New South Wales?
I think it has to be within the bounds of possibility. Absolutely, we can't say that it's not expected because the average incubation time, for SARS-CoV-2 is about 5 or 6 days. There'll be individuals who go through a much more rapid transmission cycles, as we've seen with this cluster. There'll be others that have a much longer one, but 5 or 6 days does put it potentially in New South Wales, Doves Bay Territory, or indeed earlier back in Victoria. So we have to be open to all of that.
You've effectively been accused of overreacting because of the 2 false negatives. And the Prime Minister used the word fear a lot yesterday, that we shouldn't respond with fear. Are you responding with fear and are you overreacting?
No, I agree with the Prime Minister. We shouldn't respond with fear. I think I've been calm for a year and a half and provided some assurance about the things that we need to go through to get control of this virus. I do like to warn against complacency, but all of the statements that I made about the Kappa variant, the primary one that we're dealing with in Melbourne, were factual. They relate to the fact that we absolutely have to chase every single case down. We need to get back to COVID zero. That's a significant challenge. So when I use the term beast, and Chip Legrand might think there's a technical definition of that term, I don't believe so. I'm trying to warn against complacency and to motivate everyone to get tested, to isolate, to follow the rules. I think Victorians have done a magnificent job in that regard. The fact that we're getting 50,000 tests per day, that's 5% of Victoria's been tested in the last week. That is a huge part of being able to get on top of this. And so I can only be grateful, but I want to warn against the idea that just because we've always beaten this virus back in Victoria and elsewhere, and that Australia has been virus-free in terms of community transmission for months and months and months, that we shouldn't expect that we'll be in this position forever. That is something that we absolutely have to work continually to guard against.
There's a fair few epidemiologists who say, look, there's not enough proof of the fleeting contact that is happening any more this time than previously. What hard data is there to show that there's more of that transient transmission?
Look, these might be random effects. So I'm not saying that we're dealing with, and I said it at the last press conference I attended, I'm not saying that this variant is the most infectious variant, the Kappa. It isn't. I'm not saying that it has magical qualities, but we have noted 5 exposure sites where transmission has occurred to 7 individuals, I believe, who have had less than that, usual prolonged indoor, home, work, face-to-face settings, or indeed restaurant settings. We're talking about shopping centres. That might be more thorough search, more people stepping up to get tested, but it's a reality. That's what we found, and that's what we're reporting on.
And is there any less risk to the community? Is there any possibility that you ease restrictions sooner because of the 2 false negatives? Does that make you relax a little bit more?
Oh, certainly we're happy that these are off the books. So fewer transmissions have occurred by virtue of that. There are primary close contacts that can be stood down because these aren't true cases. And those exposure sites that are related to those cases are also stood down or will be stood down. So that's all reassuring. That said, we've got disturbing news overnight, and we just need to take every single day as it comes.
Just on the examples of the fleeting cases, can I just go through them? So the two...
I'll get Jerome up at the podium because he's got some details before him, but we'll...
Sorry, just one more if that's all right, Chief Health Officer.
Right, we're not going anywhere. So just in terms of the casual contact cases that Brett's just referred to, and on the back of Raf's question, so we have 8 cases at 5 different public exposure sites. And I think as we've discussed in the last few days, each of these outbreaks that we've seen over the last 12 months, and certainly the ones we've been dealing with over this year and the end of last year, they all have their own profile, they all have their own dynamic, they all have their own characteristics. If I look at Blackrock, very much focused around a restaurant, a gathering in a restaurant that was a super spreader event that seeded it out, followed by household transmission. If we look at Holiday Inn, we have again a super spreader event at a private party at a venue, and again followed on by household transmission. This particular outbreak, at the moment, insofar as we have it right now, what is typifying it is that, of course, there's a lot of household contact, some business and social contact. We remember the workplace at Stratton Finance, but also these 8 cases of casual contact where people didn't know each other, were not aware of encountering each other, and the transmission have occurred. So we're not saying it's massively different, but we are saying that as a feature and a dynamic of this particular outbreak. What I'm really pleased about is that we've seen as a result of that so many people come forward to get tested. The fact that we've got 477,000 tests done, 50,000 or so tests a day in the last 7 days, that's exactly what we need to see if we're going to beat this thing together as a community. And we're very pleased about that, and it gives us more intelligence and ultimately more confidence about how these outbreaks are going and where we're going with.
Victoria's significantly more open than it was when we went through either the Blackrock outbreak or the Holiday Inn outbreak. Is it possible that the reason we're seeing these stranger-to-stranger transmissions isn't because the nature of the transmissions changed? It's just that a lot more strangers are coming into contact with a lot more strangers, and that cases such as the Telstra phone one, where 2 people were presumably meeting and interacting in a shop, is not an example of different transmission. It's just what you would expect when 2 people come in contact with each other.
So yes and no, and I'm sure Brett will add some comments later on. But I think if you look at the 5 exposure sites we're looking at, we do have Charles, you're right. There's that could have been a face-to-face communication, but we're also seeing other cases where it is far more casual contact. This is well below the 15 minutes that we used to deal with last year. It's a different nature of the kind of contact that we're talking about, and therefore we think it's right to call that out, because it's about collectively understanding how these outbreaks are developing, so we can, all of us as Victorians, respond to it appropriately and do the right thing. So we think it's, and absolutely, I think as we discussed in recent conferences, we have far more information than we did a year ago in terms of the level of testing that we're doing, in terms of the level of contact tracing, the speed at which we're getting into these outbreaks. So this is all good data, it's all good information. It all helps us get these things down to ground.
I just want to be specific, if we can, Jerome, on the examples.
Yeah.
So the ones that were initially listed by Brett as the key prime examples were the Brighton pub and the Mickleham display store. They're both now negatives. On the other ones, so the JMD grocer, we have no QR check-ins, so we don't know whether the people actually were there together or not. The Craigieburn shopping centre, no QR codes. We don't actually know how fleet in it was. The Woolies, no QR codes again. We don't actually know if there was crossover. And the Telstra store, the worker was the infected person. So as Rachel said, they may have just been interacting over a phone plan. So specifically, which examples indicate that there is fleeting minute or 2 minute transmission rather than just regular stranger to stranger transmission, which has been a feature of the outbreak since it began?
And this goes back to, I mean, it's a good question. There's a fifth site in Reservoir, but with 2 cases. This is a good example. This is where the contact tracing interviews are so important. This is where the in-depth discussions we're having with all of these positive cases, recognising we've now got a number of people involved in this. We're having extensive conversations. We're asking about their movements, the timing of their movements. Where there's QR code data, we use it. That's why getting more QR code data is so important. We use mobile phone data. We use whatever other records we possibly can to try and establish what they were doing. In these cases, and the reason we call them out is that the individuals concerned, the people who are positive, are not saying, oh yeah, I went to the Telstra shop and I had a 20-minute chat with a sales agent, I did X, Y, and Z. That's not what they're saying. What they're saying is, I went to JMD Grocers, I did X, Y, and Z, I didn't have interaction with anybody else. And the 2 parts of that puzzle is what's telling us that a very casual contact has emerged. So that's good contact tracing. This is great data to have. I'm sure we'd be here in a situation that said, if we'd had that a year ago, that would have been great. That's the fidelity we're at now. But it's important that we, as members of the community, that we understand that that is an aspect of transmission. So we've always said, and Brett's been really clear on this, households and household meetings and behind closed door meetings are really high risk when you've got positive cases. Workplaces can be really high risk where people are sharing cutlery, food and other bits and pieces. That's really high risk. What we're now seeing, of course, is also there is a potential for transmission at these casual contact sites.
So it's potential. With all due respect, where is the hard evidence that these are fleeting cases, or are we just basing this off what someone has said?
Well, we're basically off the fact that we've got 8 examples of people getting positive coronavirus infections at 5 locations from people that they don't know.
Is that a new thing?
Yeah, that is a new thing.
People are getting COVID from strangers?
No, the people are getting COVID at this scale in these kind of outbreaks. They're not getting it from household contacts. They're not getting it from their partners.
We've
they're not getting it from their workmates.
We've seen stranger to stranger transmission before. This isn't a new thing.
So if we go back to Holiday Inn, we did not see this intensity proportionally of strangers to stranger transmissions. If we go to Black Rock, we didn't see it. If we go back to Shepparton, we didn't see it. If we go back to Kilmore, we didn't see it.
There were a lot more mystery cases back then, to be fair. There was a lot that we didn't know.
Not in the case of Holiday Inn. UK variant, again, we're the only place to run the UK variant down to ground. Not in the case of Black Rock. So, we can go back to all the chronology, but this is, I think it is really important. It is really important if we're going to be transparent and upfront about how we as Victoria, collectively as a community, deal with these kind of outbreaks. I think it's really important that we explain this is what's going on. Is there hard evidence? Absolutely. We've got 8 people with COVID recovering at the moment.
And that's what they've recounted to you. So do you stand by that this strain, the Kappa variant that's infected these people, is behaving in a different way to what we've seen in previous outbreaks?
Yes, so certainly, and Brett can give a far better clinical explanation for this than I can. But what I can absolutely say in terms of overseeing the contact tracing event, in terms of overseeing the way we put this jigsaw together, in the way that we see the response, the way this virus is behaving, it's very different to the previous cases we've seen here, and certainly here in Victoria. Over the last year, it is operating in a different way. It's not completely unheard of, but it's very different. It's moving more quickly. And I think it's really important, if we're going to fight this thing together, that we understand that as a community. That's why I think we're getting 50,000 tests today. Those 50,000 tests, every test is really important. It helps us build that picture, because at some point, Brett has to make the judgment that says, are we confident that we've shut down all this change of transmission? As you said earlier, Rachel, when we open up again, that's a high risk call to make. We need to be as confident as we can possibly be that we've got as much information about what's happening out there and that we've got control of it.
Can I ask about Brighton?
Yeah.
That case says that they were told on Tuesday that they were a false negative. Is that true?
Yes and no. So the Brighton case and both the Mexican case, I'll deal with both of them actually. So the Brighton case tested positive on the 1st of June, reported on the 1st of June. Tested again and had to have returned a negative result on the 2nd of June, on the Wednesday at 9:30 p.m. So absolutely. So we have 2 test results for that individual, one on the 1st of June, one on the 2nd of June. We have an expert review panel that you met yesterday afternoon, to review those cases, and the Metricon case and a 3rd case. And the purpose of that expert review panel is to make a judgment call. We're not here to do a coin toss and say which result do we favour. Why did that happen? We look at all the evidence, obviously not me, and they make a judgment. That panel reached a decision late yesterday afternoon.
So when was he told that he was a false positive?
So he would have been told on Wednesday evening, the 2nd of June. He would have been told when we had that negative result to say, you've now got a negative result, you've now got a positive result. He was still a positive case as far as we were concerned on Wednesday night and yesterday until we released him sometime yesterday.
We're absolutely confident that he was not told on Tuesday that he was a false positive.
Yeah, absolutely confident. Because the expert review, and I'll be very clear about this, the expert review panel did not meet until yesterday afternoon. The expert review panel reported ultimately to Brett and to myself yesterday afternoon, late afternoon, and said we've gone through these 3 cases. These 2 are false positives. Now, whatever other conversations may have had, I'm sure he would have had. I would expect him to. This is somebody who is ultimately in our care from a clinical point of view. He would have been given information about how his negative tests are progressing. Absolutely. But the definition of a false positive can only be made by the expert review panel, and that was yesterday afternoon.
And the Mickleham display home woman, when
same deal. So 28th of May, she tested positive. Or she returned a positive test result. We retested the sample in the subsequent days on the 2nd of June. So again, on Wednesday, she returned a negative test on the new sample. We also did serology. Expert review panel met yesterday at the same time and declared her a false positive yesterday.
I understand you can't officially declare.
Okay, can we just finish the question? I'll come back to you, Rachel.
Just one more on that. So you said there were some unusual elements about those reclassified cases. When did you, I guess, first start having doubts, or when did you have uncertainty?
So I think the Brighton case was interesting, and again, maybe Brett will have a view on this as well. The Brighton case was interesting because we had he was asymptomatic, but he returned quite a strong test result, and that was unusual. So that's why we undertook with him another set of tests. We retested the swab, and then we did a new swab on him as well. I've gone through the chronology on that. The Metricon case, and again, subsequent conversations with her when she was still regarded as a positive test result, there was some confusion about the dates whether she actually worked at the display home at the time that our positive case went there. That led us again to reinvestigate that particular case. That would have been on the 1st or 2nd of June.
Was there confusion as to whether that woman was there 2 days after the infectious case or 2 hours after?
I don't have that level of detail, but there was certainly confusion, or there was uncertainty between her and her shift patterns, and the conversations we had with her subsequent to the 28th, so last Friday, was around her working patterns and when, had she actually been there, had them not. There was some confusion. Now look, and this is, again, not unusual in these kind of cases. We're dealing with positive cases. They're trying to work out what's going on. We're trying to work with them to get their primary close contacts. We're trying to work out their movements. People's recollections and information evolves. That's all quite normal. We retested. We returned the negative result.
Do you believe she was there 2 days after or 2 hours after?
I think she wasn't there on that particular day, is my understanding. So I think the landing was that she was not at that site at the day that the positive case turned up. That was different to, just for the avoidance of doubt, that was different to the initial recount. The employer gave us her details as being at work on that particular day. That's why she was tested. That's why she returned a positive result.
Which gave you an indication that it might have been airborne spread a couple of hours after an infectious case. It would have been far less likely that she would have been positive if it was a day
again,
later, right?
we don't, and again, Brett can talk to this, we don't make a judgment on the entire nature of transmission based on one case. So we have, in this particular example, the line of questioning we're on at the moment, we now have 8 cases who typify for us that kind of casual contact at a public exposure site. So we think when you've got 8 cases like that, that is materially different to what we've seen in the previous big outbreaks we've run to ground.
We understand that that things need to go through the expert review panel to be absolutely certain.
Yeah.
But there was evidently doubt on Tuesday and with the Brighton case, and doubt on Wednesday, and in fact it was broadcast on ABC News that the Metricon woman on Wednesday morning had received a negative result, indicating that that initial positive result was perhaps false. Why, in the interests of informing Victorians who are locked down at the moment as a result of all this, in the interests of giving them as much information as possible, why didn't you communicate to them that there were these possible false positives that were under review?
Well, because we've got 6,000 primary close contacts. This is a huge and fast-moving and rapidly evolving investigation.
Either 2 of 6, then it would have been fewer than 60 cases, though.
Yeah, but I mean, we've got 60 cases. We've got now 8 cases. We did have 9, 10 cases of exposure in these casual contact type environments. So of course, it's hugely material to the individuals concerned, but we're not going to rush that work and do it improperly. And in fairness, I think we're pretty transparent about how we communicate what's happening with these outbreaks. But I can't go through 6,000 primary close contacts and give you a day-by-day update on how each one is moving. And actually, I can't even do that with 60 cases and give you an individual update on where each one is moving. They will all continue to evolve and go through their own cycle. The material point I think I would suggest is that we did not, and again, this is Brett's call, but we did not make a decision about where we were with the entire outbreak based on these 2 cases alone. They are 2 cases in the context of 60. They are, and if we're going to entirely focus on casual contacts, which is not the entire focus of the investigation, we've got 8 of those at this point in time that we're worried about. We've got 2 less than we did have. It doesn't change the narrative and the structure and the dynamics of what we're seeing is happening with this outbreak.
Can I go back to the Delta outbreak? Who are you guys trying to track down?
Sure.
Who are primary or secondary close contacts of anyone involved in that outbreak?
Yep.
Or is everyone involved, potentially infected in the Delta outbreak, in quarantine already? So who are you looking for?
Yeah, so we believe, so bear in mind we started with a family of 4 from West Melbourne who returned from Jervis Bay last weekend or the weekend before. So we have identified all of their primary close contacts. We identified them a couple of days ago. It includes a significant group of the school community at North Melbourne Primary, and can I just do a shout out to the school? They've been absolutely fantastic in their support of their school community at this time. So we have over 300 primary close contacts for that initial group of 4 people. That's why the 3 people that we returned a positive result last night are already part of those primary close contacts. They were already isolating. We have a 4th indeterminate member of the same family. So we'll see where that lands over the course of the next day. So we continue to work with those 300 plus primary close contacts. Obviously, we're now working with the new family to see if there's anything else that's happening in their world that we need to be concerned about. That work's happening now.
How many of the Delta primary close contacts have tested negative, and how many test results are still being looked for? And just further to that, logistically, what are you doing to try and track down the index of this Delta case? Are you going into hotels? And New South Wales Health Authorities going into their hotels? What's been done?
So we've got, as I think indicated briefly, we've got of the 300 plus primary close contacts for the West Melbourne group, we've got 70% of those people have now returned a negative test result. So that's the kind of number we expect to see after a few days. We'll continue, of course, to encourage and support testing for that group, and of course we're working particularly with any vulnerable members of the community in that particular cohort. So that work will continue, and as we've seen with other parts of this outbreak, it will take us a few days to work our way through that and to make sure we follow all those leads. In terms of acquisition testing, that's a real priority for the next few days over the weekend. As we speak, there's been conversations happening with our colleagues in New South Wales, ACT, and in the Commonwealth around whatever information they have around particularly positive cases already that have been in their care recently. Are there any other examples of positive cases that have not yet been sequenced that we can do more information around? Obviously, that work's also happening within Victoria, so we're looking at any records we have of positive cases in hotel quarantine, the vast majority of which do get sequenced, any diplomats that have returned, any sea ships that have returned, any other cases that might have come into our community. We're going back and hauling all that work up at the moment.
How many of them are in New South Wales?
Rich, I'll come to you.
Just on the West Melbourne issue, are any of the 300 close contacts in the nearby public housing towers?
No, so we have primary close contacts that are in that vicinity. I don't think we have, and I think we probably have one or two primary close contacts who are within our public housing estate. We've got a whole team working to support all those communities, and we'll continue to do that.
So just to clarify, so there are close contacts in the towers?
Yeah, I believe there's a small number of primary close contacts.
I'm sorry, and with you say 70% of the 300 odd, the other 30%, have they not come forward for testing, or we're still waiting for results?
It's a continual process, Rich. So I mean, we as we see testing results come through, so people who went and got tested late last night probably haven't, with their results will not be in the numbers I've reported today. So that's a continual process. So the fact we've got 7 out of 10 already returning a negative result is a really encouraging sign. We'll be supporting the remaining 30% to get those results in.
And how many days do we think this grade 5 student was at school while infectious?
I believe 2 or 3.
And of the 2 families, are we confident the family that went to New South Wales, did they have COVID first?
At this point, that's the indication. So we are, and I think as Brett has indicated, we believe that one of the parents of that family of 4 is likely to be the index case of that cluster of 7 that we know about at this point in time. Now, of course, what we're now looking for is where did they contract COVID from, and that's the really important question for us to land. Sorry, Ralph.
Just with the 300, it's not clear to me. Are some of them in New South Wales?
No. So the 300 are the 300 we're focusing on. Obviously the people that are within Victoria's care. So we're focusing on those 300 at the moment. We're obviously now working very closely with colleagues in New South Wales. I know they do.
Do you know how many there are in New South Wales?
I don't have that information to hand, I'm afraid.
Is there any indication based on the occupation or movements of the parents where it could have come from? Do they work in high-risk settings?
No, so at the moment, the parents that we're aware of and the information we have at the moment is not of any connection to high-risk settings. We obviously are aware of the workplaces of the first two parents. I don't have the details of the second two, but there's no connection at this point in time to high-risk settings.
What do they do for work?
I'm not going to comment on that. It's not material to the investigation.
Jerome, the people in hospital, do any of them have the Delta variant?
No, the people in hospital are, we have two aged care residents who are really there, who are in Epping Private Hospital, really just for removing them from the aged care environment. They are asymptomatic at this point in time, so we're not concerned, and we wish them well, because it's really important that our most vulnerable members of the community do recover well.
Can I just ask the Chief Health Officer a few more questions? Is that okay? I guess this plays into the politics a bit, but also, if you can comment on how different Melbourne is to Sydney. There's a lot of people saying, how come Melbourne keeps on going into lockdown? Some people say different geography, different demography. How much of it's luck? How much of it's because they're different cities with different settings?
I don't know the answer, Raf. In many respects, they're very similar cities. But we've seen the randomness of individuals infected with this virus across the country. There are individuals who've been infected out of hotel quarantine who simply weren't infectious in all the time that they're in the community. So there's nothing to lock down, there's nothing to be concerned about because no further transmission occurs. It's fair to say that our BlackRock outbreak was chased down without a circuit breaker. There were some minimal restrictions that were put in place over the course of that period. We've had transmissions in hotel quarantine where we've just followed up the individuals who've been out in the community without any further restrictions. But we have to do what's proportionate when you've got significant community transmission. With respect to this outbreak, we had 3 or 4 generations of transmission before the first case was identified. That makes a huge difference. That's, dozens and dozens of people already exposed who are about to become cases, which is what we saw. We saw 24 people as positive cases in the first couple of days of the outbreak. That makes a huge difference because you can follow them down prospectively. But if, as I said at the last presser, if every single one of those cases has 100 close contacts going to nightclubs, going to pubs, and across dozens of exposure sites, you are chasing down a huge number and it just increases.
And how worried were you when you heard the sequencing overnight? It's a variant not linked to anything seen before. That makes me worry. Should people worry?
We just have to do what we have to do. It's new information. It's an unrelated cluster, and it's a variant of significant concern.
Did you get worried when you heard it?
No, I didn't get worried. I know what we have to do. It's not a question of anxiety. It's a question of being absolutely thorough in the investigation of where it's come from and doing absolutely everything, as we do for our existing Melbourne cluster, doing absolutely everything to run it down. The point I've made about other international jurisdictions, do you think for a moment Taiwan would want to be dealing with 300 cases a day and could look back and think, what on earth could we have done differently to have maintained our COVID-free status? The same for Singapore in a month of lockdown and, not out of control, but not driving numbers down. And what's the prospect of easing restrictions if you've got ongoing community transmission? So the point about getting to COVID zero in terms of community transmission is a really pertinent one. It's what allows us to do everything we've been able to do over the last 6+ months.
Can I just ask one more? Just one more. Do you talk to Kerry Chant about your different approaches? Because a lot of people say New South Wales different to Victoria. Do you talk to her about her approach?
Of course we do, but they're not necessarily different approaches. So if Kerry Chant were dealing with this, I can't second guess, but I imagine that it wouldn't be a case of just using contact tracing. I imagine there'd be restrictions in place. When the Sydney outbreak started in Avalon, same kind of scenario. A few generations of transmission probably already occurred when the first cases were known and Avalon was shut down. Now that was geographically fortunate for Sydney in terms of being able to really focus on those suburbs. If we had, you know, that kind of circumstance in Melbourne, we could take a similar approach. So I wouldn't say that they're manifestly different.
Just on the theme of fear and worry, we were talking about fear earlier. Some people in that school community are going to be really scared. What would you say to them?
We've got hundreds of tests back. We're going to get the remainder of those tests back. The things to do to protect yourself are the things that we've always said. You know, despite the fact that some variants of concern, you know, with the millions of cases that have occurred in India, have affected children more severely, children are still overwhelmingly going to get mild disease or asymptomatic disease. Kids don't need to be afraid here. We need to just do everything to make sure no further transmission occurs.
Last October, when we were starting to come out of lockdown, it was less than 5 cases a day. That's the average at the moment. So why can't some restrictions be eased on that same metric?
So we need to bear in mind that we were entirely open as this outbreak took off, and that we've got the close to 6,000 primary close contacts and more than 300 public exposure sites to run down. So we need the time to see how that plays out. We are not in the easing from a very restricted settings. We are going from a very open and therefore lots of exposed individuals to a lockdown period, and we need to take this time to review.
But have any of the settings been reviewed overnight?
Settings with respect to what?
Any of the restriction settings been reviewed overnight?
No, look, there's no material change overnight. We will sit down with new information today.
And how much does the revelation of the Delta strain play into your considerations over when and whether to ease restrictions?
Yeah, we certainly have to identify what the origin is. It'll make a huge difference if there are unknown chains of transmission that reveal themselves in Melbourne versus none at all, or in another jurisdiction. That will make a difference. In terms of managing the cases that we've got now, I think we can kind of loop them into all of the other cases that we're managing in the Melbourne cluster, and we'll run that down. That's not an issue, but where it's come from needs further investigation.
And going back to the questions about Kerry Chant earlier, should she be worried at the moment, given that there is a possibility that this has come from New South Wales?
I'm not going to give Kerry advice on how to respond emotionally to this. She's very expert as a Chief Health Officer, loads of experience, done a magnificent job in New South Wales, and we're here to support her, as no doubt she is to support us.
Out of curiosity, how
Were
often...
some test results wrongly labelled and the wrong people were given positive test results?
Not that I'm aware of.
And are you confident with all the private pathology doing the work, particularly I think it's VCS?
Look, they do magnificent work. When you have 500,000 tests run, 2 that have a false result, is tiny and not unexpected when those huge testing volumes occur. That's an inherent feature of any pathology test.
You mentioned that this variant has been in hotel quarantine. Has it been in Victorian hotel quarantine?
It has. It has in all of the eastern seaboard states, I believe. It's been in hotel quarantine. It's just a feature of how common it's becoming.
Do you know when it first came to Victorian hotel quarantine?
I don't know the original date of someone with that variant, but as I say, no match whatsoever.
What's the quantum in hotels in the last weeks or month? How many?
Oh, you'd have to go to Emma Cassar, CQV Commissioner, for that.
Significant, or
it's not insignificant. It is, you know, the predominant strain now in the UK. It's beginning to creep up in the US, and it's everywhere in South Asia.
And you just talked about how important it will be to find where it's come from. If in 5-6 days' time we still haven't, through genomic sequencing, figured out where it came from, will you still be in a really worried state this time next week and unwilling to kind of let restrictions go because there could be undetected transmission?
I'm not speculating on what my state of mind will be or what my thinking will be 5 days from now. There's a lot of time to play out.
Is there a possibility it leaked from our hotel quarantine system?
Oh, there's no link anywhere whatsoever. So nothing's ruled in, nothing's ruled out. We need to follow every line of investigation.
And just out of curiosity, how frequently is the expert review panel meeting?
Oh, they do it on an as-needs basis. So any ambiguous test result or one that needs that expert pathology input, they'll come together.
So how many cases are they reviewing right now?
I don't know that there's anything before them right now, but I don't follow it on a day-to-day basis. They report when they've got findings to make.
And to clarify, those cases, there's 2 people in hospital, but they're the aged care cases?
That's right.
And no one else is in ICU or anything like that?
No.
At future press conferences, will you be able to let us know if there are cases being reviewed by the panel?
Oh, we can look into that. All right. Thanks, everyone.
Just on the nature of the variants.
I thought I heard last question.
So I've got one for Foley, but you can
Just
go.
on the nature of the variants, it's my understanding that Kappa is considered a variant of interest, not a variant of concern. Delta is a variant of concern. Can you talk us through the differences?
So I'm not sure if that's true, but we can check. The variants of concern are when the epidemiological view informed by WHO suggests that there is something about those variants that is where there's good evidence of reason to be concerned, either severity of illness, transmissibility or immune escape. For variants of interest, it's often because they share some of the mutations and therefore you might expect that they also have immune escape potential or increased transmissibility potential, but hasn't been demonstrated because there hasn't been enough time or there haven't been enough studies to show that that's the case.
And very quickly on the number of cases today, you've said it's 64. Yesterday it was 61, accounting for the 2 that were deleted because they were false positives.
Yep.
But we've got 4 new cases today. 61 plus 4 is 65. How have we arrived at 64?
I think we've had a recovery from the beginning of the outbreak.
Active numbers.
Correct.
Can I just ask the Health Minister one quick question about please? Sorry. Just on the business grants, sole traders have been left out with earnings less than $75,000. What should those people do to get through these 2 weeks?
I'd have to refer that matter to the relevant minister and let you know. I'm not thoroughly briefed on that. I've been focusing on the health sides of things, so we'll get back to you on that. Thanks, everyone.
Thanks.
Just one more, if we could. Just one more. Is it possible this case came from somebody who was exempt from quarantine, perhaps a cricket player?
Well, there's no evidence. Nothing's on or off the table. This is just come in late last night, as the Chief Health Officer has indicated. We'll work through every proposition. It's